Hi guys, welcome to our gross anatomy abdomen lecture. Today we are going to talk about the anatomy of the small intestines. Right. So the small intestines are actually classified into three. We have the duodenum, jejunum, and the ileum. So right here, this is your duodenum, and this is going to be your jejunum and ileum, right? So the small intestines are important because that's where there is food absorption, as well as final digestion takes place. Right. So the let's us start to talk of the jejunum, the duodenum, and then we'll later go and talk about the jejunum and the ileum. So the duodenum is actually a C-shaped loop, right? Which most of its part is the retroperitoneum, and only the first part of the duodenum, about the first 2 centimeters, is actually intraperitoneal, as we're going to see. So let's take a look at the duodenum. Right, so the duodenum is actually the widest of all the intestines, and it is divided into four. Right, so this is the first part of the duodenum. Right, this is going to be the second part of the duodenum, which is descending. This is going to be the third part, and this part that is ascending is going to be your fourth part. So let's start with the first part of the duodenum. The wall of the duodenum is 25 centimeters long, with its first part and last part, part being 5 centimeters. So this first part is 5 centimeters. All right. The first part of the duodenum is, if you are going to look internally, it's actually going to be a portion of it is going to be smooth, right? And then the larger part of the duodenum is actually going to be the lumen is going to be folded with those plica secularis. The first part superiorly and inferiorly, the first part is going to be attached to the lesser omentum via the patoduodenal ligament. Remember, that will be having your portal triad, your portal vein, your hepatic artery, and the bile duct. And then the inferior part is going to be attached to your greater omentum. Let's take a look at some relation. What is anterior to the first part? So to the first part, you're going to have the caudate lobe of the liver, right, in its anterior portion. And then inferiorly, you're going to have the head of the pancreas, as you're going to see. Good. And then superiorly, the superior portion of the first part actually forms the epiploic foramen. You remember, the boundaries of the epiploic foramen, the lower border of the epiploic foramen was the first part of the duodenum. Then the second part, which is the descending part of the duodenum, medially is the portion that is going to be pierced by the duct, by the bile duct and the main pancreatic duct. Remember, and they're going to have what you call the major duodenum papilla, right? And if there is an accessory pancreatic duct, it actually pierces above, about 1.9 centimeters above the major duodenal papilla. You're going to find your minor duodenal papilla. The second part is the one that posteriorly is going to be sitting on the hilum of the right kidney. You can actually see the right kidney here. Good. And the right ureter. So posterior relations of the second part, you have the kidney, right kidney, the heel of the right kidney, and the right ureter. Then anteriorly, you're going to have um, the transverse colon, right? and its mesocolon as well, right? Um, and then medially, you're going to have the head of your pancreas. Then laterally, you're going to have the ascending colon, right? The ascending colon together with the what? With the hepatic colic flexure. They're going to be lateral. Good. So the second part is actually about 8 centimeters long. It's about 8 centimeters long. That's the second part. Then the third part of the duodenum is very important because you're going to have the root of the mesentery actually anterior to the third parts of your duodenum. And what will be found within the root of the duodenum? The superior mesenteric arteries. So you have the superior mesenteric vein, which is to the right of the superior mesenteric artery, will actually be anterior to the third part of your duodenum. So they'll be anterior to the third part of the duodenum and then anterior to the antennate process, right, of the pancreas, if you remember. And then if it is the superior mesenteric vein behind the neck of the pancreas, it joins the splenic vein, which would have joined the inferior mesenteric vein behind the body of the pancreas. And then it forms the hepatic portal vein, right? And it is the hepatic portal vein that will be within the hepatoduodenal ligament going to the porta hepatis of your liver, right? So that's your third part, right? So then posterior to the third part, you can actually see a portion of your inferior vena cava and then a portion of the aorta, right? A portion of the aorta. Good. Let's take a look at the last fourth part. So the fourth part. So this one, the second part. Okay, in terms of the lumbar vertebrae, the first part will be along the L1. So the first part of the duodenum is along the transpyretic plane, and then the second part of the duodenum will stretch from L1 to L3, right? And then the third part is going to be along L3. The fourth part is going to ascend from L3 to L2, forming what you call the 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 the, the jejunal the duodenal junction, right? The duodenal junction, right? That's going to be formed by the fourth part of the what? Of the duodenum. Take note of this. The fourth part of the duodenum is actually going to be attached to um, uh, it's actually going to be fixed by an attachment of a ligament called the ligament of Treys, right? Let me look for a diagram that actually exposes the ligament of Treys. But the ligament of Treys, it attaches to the what? The fourth part of the duodenum, which is also 5 centimeters. Right, so you can actually see in colors, this is your first part, which is along the L1, 5 centimeters, right? And then this is your second part, which is about 8 centimeters, right? You can actually see the minor duodenal papilla for the accessory pancreatic duct piercing the medial wall of the descending portion of the second part of the duodenum, and the what? The major duodenal papilla, right? And posterior to the first part, you can actually see you have your bile duct. And the bile duct is going to be to the right of the gastroduodenal artery. So the bile duct is going to be posterior to your first part of the duodenum, and then travel through the groove of the head of the pancreas, and then it meets the main pancreatic duct, and then drains into the duodenum via the major duodenal papilla. Right, guys, this is going to be your third part of the duodenum, which I said anteriorly is going to be crossed by the superior mesenteric vessels that will be within the mesenteric proper. And then inferiorly, you're going to have the coils of your jejunum, and then superiorly you're going to have your pancreas, and then posteriorly you can actually see the inferior vena cava, and the abdominal aorta. Right. Right here, that's your ascending fourth part. Your ascending fourth part is actually 5 centimeters, which I said it ascend from L3 to L2, and then its portion is going to terminate as the jejunal as the duodenal jejunal flexure or the duodenal jejunal junction right here, right, and that's where you have your your ligament of trace. So the ligament of trace is a ligament that attaches the fourth part of the duodenum to the left cruise of the diaphragm. To the left cruise of the diaphragm. So the duodenal flexure is actually fixed. It is what? It is fixed. You understand? Good. Now let's just take a look at the jejunum. So because now we are going to continue as the small intestine are going to continue as the jejunum. Let's take a look. Oh, before we take a look at the jejunum, let's take a look at the blood supply of the duodenum. So the duodenum is going to be supplied by the pancreatical, the superior and inferior pancreatical duodenal arteries. The superior pancreatical duodenal arteries are going to be branches. You can actually see these. They're going to be branches of your gastroduodenal artery. And then the inferior pancreatical duodenal artery, they're going to be branches of your superior mesenteric artery. And then as for the venous drainage, the pancreatical duodenal vein is going to drain directly into your portal vein. You understand? Good. Let's take a look at another diagram. Right, so this is a good diagram to actually give a summary of the blood supply to the duodenum. Right here, this is your celiac trunk. This is your left gastric artery, your splenic artery, and this is your what? Your common hepatic artery, right? So you're going to have a branch called your gastroduodenal artery, and it is the gastroduodenal artery which you said is going to be posterior to the what? The first part of the duodenum. Remember? Good. And then this one is going to give us the right gastromental artery, which you anastomose with the left gastromental artery of the stomach. And then it is going to continue as the superior pancreatical duodenal artery. So the superior pancreatical duodenal artery will actually be divided into two, anterior and posterior. So the superior pancreatical duodenal artery is a branch of the gastroduodenal artery. And then the inferior, you can actually see this is your third part, and we say that the superior mesenteric vessels are anterior to the third part. So the superior mesenteric artery will actually give the anterior and posterior inferior pancreatical duodenal artery. So this will supply the pancreas as well as this will supply more specifically the head of the pancreas as well as the duodenum. So that's the blood supply. As for the venous drainage, the pancreatical duodenal vein drains directly into the portal vein. Right. And as for the lymph vessels, so remember embryologically the duodenum comes from the foregut and the midgut. So the foregut, the lymph via the the superior pancreatical duodenal arteries will drain into the celiac lymph nodes, and those via the inferior pancreatical duodenal artery, which is a branch of the superior mesenteric artery, will drain into the superior mesenteric lymph nodes. Right. Good. As for sympathetic and parasympathetic, it's going to be innervated by the celiac plexus and the superior mesenteric plexus. So that's the innervation. Now, we said the fourth part of the duodenum, which is attached to the ligament of trace, which attaches to the left cruise of the diaphragm, is going to, that's where you're going to find the duodenal jejunal junction. So you're going to have the origin of your jejunum. Let's take a look at the jejunum and ileum. Right, so let's take a look at the small intestines. We spoke of the duodenum, right? And now we are now talking about the jejunum and the ileum. So right here, this is a diagram that actually showing you the orientation of the small intestines in your abdomen. So this right here in blue, that's your jejunum. This is your duodenum, jejunum, and ileum. The jejunum and the ileum are actually 6 centimeters long, 6 meters long, right? The jejunum being 2/5, the ileum being 3/5 of that length. So if you're going to look at, there is no clear demarcation between the jejunum and the ileum, but this is how you can actually find them or differentiate them gross anatomically. So the jejunum loops are actually positioned in the left upper quadrant. More of them are found in the left upper quadrant, right? And then the ileum is actually mainly found in the right lower quadrant. Good. Mhm. The jejunum and the ileum, they extend from the duodenojejunal junction to the ileocolic junction. So there's going to be a mesentery that suspends the jejunum and the ileum in the abdominal cavity. And the mesentery of the jejunum, to be specific, is going to be in the upper left portion of your abdominal aorta. The mesentery of the ileum is going to be at the lower right of the abdominal aorta. You understand? Good. Let's take a look at another diagram. Right, so right here you can actually see the mesentery of the jejunum and the ileum. This is the root of the mesentery of the jejunum and the ileum. It extends from the jejunal, it extends from the duodenojejunal junction to the ileocolic junction, right? And it is oblique. This mesentery is going to allow passage of the neurovascular structures, which is your blood supply via superior mesenteric vessels, your lymphatic drainage, and your nerves to the small intestines. You understand? So there is a distinction between the jejunum and the ileum. Differences between the jejunum and the ileum. Let's take a look. Right, so actually this is the wall of your small intestines. Right, from histology we understand we actually start with the epithelia, which is simple columnar epithelia. We go to the lamina propria, to the muscularis mucosa, then submucosa, circular layer, and longitudinal layer of the muscularis externa. You understand? And then this right here is your mesentery. You can actually see blood vessels, lymphatics, and nerves, the neurovascular structures being supplied to the wall of your small intestines. Right. So let's take a look at the distinction between the jejunum and the ileum. Let me zoom. Right. The jejunum is thicker and the lumen is a greater caliber and readier than the ileum. So The jejunum is thicker than the ileum, wider than the ileum. The lumen is actually this one is about 4 centimeters. This is about 2 centimeters, 2 to 3 centimeters. The jejunum is actually reddier than the ileum. The ileum is a bit purple, dark red, purple, right? So the reason why the jejunum is reddier because it has a high vascularity as compared to the ileum. In the luminal or mucosal folds, the jejunum has abundant plica secularis, right? That are actually through and closely packed. The ileum, the plica secularis of the ileum, you can actually see this is the proximal part of the duodenum. These are the plica secularis. They're actually numerous and closely packed. The proximal portion of the ileum, the plica secularis, they are actually sparse and short. In the distal portion of the terminal portion of the ileum, there are no plica secularis. Good. Then the jejunum is actually going to be more vascularized than the ileum. Good. And in terms of the mucus, in terms of the lymphoid aggregation, you're going to have a lot of lymphoid tissue in the ileum than the jejunum. That's why the ileum is a bit darker. So you're going to have abundant of pia patches, right, than the jejunum. Right, another difference is in their blood supply. We already said that the jejunum received more blood supply than the ileum, but the structure of the blood supply is actually different. So in the jejunum, you're going to have few atrial arcades with the long vasarcters, right? And then in the ileum, you're going to have abundant atrial arcades, right, with the short vasarcters. That's another difference. Another difference is due to the fat content within the mesentery. Let's take a look at the diagram. Right, so from this diagram, you can actually see that in the ileum there's abundant atrial arcades, right, and short vasarcters. In the jejunum, there are few atrial arcades, but with the long vasarcters. A thicker, you can actually see the thick wall of the jejunum here, the thin wall of the ileum here. And in terms of adipose tissue, you can actually see that the ileum, the jejunum, leave these windows, right, of fat. The fat is not actually abundant as compared to the ileum. The ileum, the fat is actually abundant. You can appreciate these pia patches, right, that are abundant in the antimesenteric border of the ileum. Take note of this, NB, antimesenteric border of the ileum, the pia patches, right? And you can actually see these terminal, these mucosal fold, permanent mucosal fold, your plica secularis, that will be actually closely packed and abundant in the jejunum. So those are the main differences of the jejunum. And another difference is in terms of length. We say the jejunum is actually 2/5, and then the ileum is actually 3/5 of the 60 of the 60 meters. Right. Let's take a look at the blood supply of the jejunum and the ileum. Right, so this is actually a fascinating diagram exposing the blood supply to your small intestines. We spoke of the blood supply of the duodenum. We are done with that. Now we want to talk about the blood supply of your um, jejunum and ileum. So from embryology, you have to understand that the jejunum and the ileum, they are part of the midgut. So if they are part of the midgut, what is the main artery that supplies the midgut? That's the superior mesenteric artery. So the superior mesenteric artery is going to be found within the mesenteric proper of the jejunum, the ileum, commencing at the lumbar L1 of the abdominal aorta. Then it descends downward anterior to the anterior process of the pancreas, anterior to the third part of the duodenum, right? And caught within the root of the mesentery. You understand? Then it's going to send about 15 to 12 branches, right, to the jejunum and the ileum. So these are the branches that will form the atrial arcades. And then from the atrial arcades, we're going to form the vasa recta. The vasa recta. You understand? Good. So that's the blood supply to the jejunum and ileum. As for the venous drainage, these are these the the veins uh, from the jejunum and the ileum, they all are tributaries of the superior mesenteric vein, right? Remember the superior mesenteric vein behind the neck of the pancreas joins the splenic vein to form the portal vein. You understand now? Good. As for the innervation, you are receiving um, innervation from the superior mesenteric plexus, and the lymph nodes or the lymph drainage will end in the superior mesenteric lymph nodes. Right. So yeah, thank you so much, guys, for watching this video. See you next time and take care.